Insulin resistance is at the corner that leads to all of these chronic metabolic diseases, whether it's heart disease, whether it's diabetes, whether it's cancer, and for that matter, also dementia. I happen to think that a fasting insulin is the single most important lab test that your doctor can get on you. They say, well, fasting insulin levels do not correlate with obesity. It correlates with metabolic health, and that's what you care about.
This episode features Dr. Robert Lustig, and he'll talk about the most chronic health problem that you most likely have. That is insulin resistance.
93% of Americans have at least one aspect of metabolic dysfunction. Only 7% of Americans are metabolically healthy. And the way you know you have metabolic dysfunction is if you have insulin resistance. So that means 93% of Americans have a fasting insulin that's above, I would say, 5 microunits per mil. And that confers some degree of metabolic dysfunction. Now, most people don't know whether they have insulin resistance. And the reason is because they haven't gotten a fasting insulin drawn by their doctor. They haven't known to ask, and the doctor hasn't known to do it. So the question is, why is that? I happen to think that a fasting insulin is the single most important lab test that your doctor can get on you. Yet, the insurance company won't pay for it. And the American Diabetes Association specifically admonishes doctors for drawing a fasting insulin. How can this be? How can I say it's the most important test, and the American Diabetes Association says, don't even draw it? How can that be? The American Diabetes Association says don't draw a fasting insulin on people for 2 reasons. And both of them, I think, are species. The first is they say that fasting insulin levels are not standardized across the different assay platforms that are available. And they're correct. That is true. There are a lot of different insulin assays. Some of them are cheap and some of them are expensive. And the problem is that the cheap assays, for the most part, which are radioimmunoassays or ELISAs, they will pick up competing substances in the assay. And there is one particular competing substance that is a big issue. The first, that substance is called proinsulin. Now, proinsulin is not a hormone. Proinsulin is a prohormone. It is the precursor to insulin. Your beta cell in your pancreas makes proinsulin, and then an enzyme in that pancreas called PC1, prohormone convertase 1, has to cleave a piece out of that proinsulin in order to make the mature insulin. Now, proinsulin has about 5% activity compared to the mature insulin. So you don't want to be releasing proinsulin. You want to be releasing insulin. Insulin binds to the insulin receptor much better than proinsulin. But the problem is that proinsulin binds in the assay. And so it can give you a fictitiously elevated level. That is true. So what? If it's high, it means your pancreas is overworking. So yes, it's true. It would be nice to be able to know what species you're measuring. I don't argue that. But if it's high, it means you have a problem. And it means you need some form of medical/dietary therapy to improve the situation. And as long as your doctor is using the same platform each time he draws the level on you, you can use those to look at before and after and make decisions on it. So I think their reason for saying don't draw it is wrong. I think it's specious. The second reason they say don't draw it is the following. They say, well, fasting insulin levels do not correlate with obesity. That is also true. It correlates with metabolic health, and that's what you care about, because there are plenty of thin people who are sick And there are many fat people who are healthy. So your degree of obesity is only mildly related to your metabolic dysfunction. Yes, it is true that more obese people are sick than thin people. 80% of obese people are sick compared to 60% of thin people. But 60% of thin people are sick and they don't know it.